Come in.
Hi, my name is Sam. I'm going to be your student nurse today. Is it okay if I record this
Yes.
exam? Okay, awesome. Can I get your first and last name and your date of birth?
Stephanie Beatrice, August 5th, 2002.
Okay, I'm just going to confirm that on your wristband. Awesome, thank you, Stephanie. Today I'm going to be performing a cardiac assessment on you. I'm going to inspect your skin, palpate your veins and arteries, and auscultate your heart sounds. But before we get started, are you experiencing any dizziness, palpitations, chest pain, or shortness of breath?
No.
Okay, perfect. I'm just going to reposition you into the recumbent position. Okay, I'm just going to inspect your skin. Okay, skin is symmetrical in color, intact, and no signs of cyanosis, pallor, pulsations, or heaves. I'm just going to palpate your pericardium for any tenderness, pulsations, or thrills. Okay, no pericardial tenderness, masses, or thrills. The PMI is located at the 5th intercostal space and mid-clavicular line. Would you be able just to turn your head to the left? I'm just going to inspect your jugular vein. Okay, perfect. And I'm just going to palpate your carotid artery. Perfect. The carotid artery is +2 bilaterally. Okay, now I'm going to auscultate your heart sounds. Okay, now I'm going to listen for murmurs. Okay, it is a normal rate and rhythm. Your heart rate is 78 and I have no murmurs. Okay, now I'm going to palpate your upper extremities. Okay, I'm going to palpate your brachial pulse. Okay, palpate your radial pulse. Palpate your ulnar pulse. Okay, I'm going to do a capillary refill. Okay, skin is dry, warm, and intact. Your capillary refill is less than 2 seconds, and your upper extremity and your peripheral pulses are both +2 bilaterally. Now I'm going to inspect your lower extremity skin. It looks warm, dry, and intact. No signs of lesions, pallor, cyanosis, swelling, or edema. Now I'm going to palpate your lower extremities. No, this is where I would palpate the femoral pulse. But now I'll palpate the popliteal pulse. I'll palpate the dorsalis pulse. I'll palpate the tibial pulse. Do a capillary refill on the toe. Your capillary refill was less than 2 seconds, and your pulses were all +2 bilaterally.